This message is from MZHellFYRE. The person asks, are there any self-massage techniques for bruxism? I have a lot of tension and often pain and soreness from the teeth grinding. Seeing a massage therapist is not an option for me right now, so I was hoping there's something I could do on my own to relieve some of the tension in the jaw, neck, head area that comes from grinding. I could really use any bit of help. Thanks. With bruxism or TMJ kind of problems, what you want to do is you can massage this area. So you can take your fingers and kind of like circular friction this. That's just a way to kind of open up those areas first to make it kind of relaxed to start with then. Okay, so you're just going like this, relaxing. You can go both sides, but sometimes it's better to go the unaffected side first. So if it's less pain on one side, and then you can kind of gauge it how much the pain is on the other side when you're pressing those areas. So again, just to relax that area. But the place where you can even where you can feel the temporal mandibular joint, it's called, is you got to put your finger in your ear and just go like this back and forth with your jaw. That's the area. So try not to do this in the car, okay? So so you're just going back and forth. You can feel that actual joint. So it's right in that area. Sometimes it's giving you problems too. So right up there, you can just hold and just kind of slowly open and close, back and forth. You can even hold it there for a moment too if you want. Another option is you can go inside your mouth, especially if you're going to be working with somebody else. On somebody else, you'd be wearing gloves. And I just washed my hands, but I'll show you with because I don't have any gloves on hand right now. So what you're going to do is you're just going to go inside your mouth and kind of stretch these areas out. Then, so this area I'm just kind of stretching to kind of relax it. Is what I'm trying to do. And what I'm going to do next is I'm going to try to go way up into the upper teeth up here, way in the back of the molars. So I'm going to go out there, and you can kind of massage in that area too, to help relax that area. And what you can do too is just kind of slowly open up your mouth and slowly close it to kind of relax it then. So it's probably better to go this way so you're not getting your nails up in that way. So again, just go out there and slowly, and you can kind of slide your finger back a little bit each time to get in the actual area. But again, the unaffected side first, then the affected. But these kind of techniques can be used on a massage client too. But again, make sure you're wearing gloves, just for sanitary reasons and everything else. Make sure the gloves are latex free and powder free, so make sure it's both of those things. Some people will use a finger cot or a finger condom, some people call them. So let's say a person gets a cut or something, they'll just put a little finger cot right over the finger, but some people use that to massage people's inside of their mouth then. But that's the main area. You have to go way up in there, but you're going to notice it's going to be a lot of discomfort in those regions. Or you can even go both at the same time and get stretched, and you can go active hard, so go protraction, retraction like that too, back and forth. But again, right up in that area. But what you want to do too is if you're having headaches from it, you can even go along the jawline, the gastric muscles, what they're called, and you kind of got a hook underneath there. So the first one is right here. You can hook underneath there. You can hold that. So sometimes it can refer pain in those regions too, or other areas underneath. So you're going to go up and kind of hook under and hook this way. So you're not going up and hooking this way at all. So you're going up and hooking towards the mandibles, what you're doing. So you're underneath there and finding those areas then. But just go to a little discomfort. Again, if it's if you're holding it there for too long, sometimes you can get more soreness then. So again, those are some of the kind of techniques you can use. And you can even go open like this, kind of slow. stretching that area out too. Because the problem is, again, sometimes that area gets really tight. That's what causes sometimes the grindiness. Or sometimes people get really stressed out too, and they don't even realize it. But some people will perform it at night, so they'll have to wear a mouth guard, so they're not grinding at night too. Then, so those are just different options. But again, the areas you want to find out which areas your headaches are. So if you can leave me a comment where your headaches actually are, we could tell you some other muscles to concentrate on then. So that concludes that, and any other kind of comments or questions, leave in the comment section below, and thank you.